Welcome to the next talk in our NMH Resilient Kids Summit series, part of today's workshop on natural approaches to depression. The title of this presentation is An Antidote to ACEs, Resilient Childhood Experiences. I'm Dr. Tim Culbert. I'm here with my friend and colleague, Dr. Anastasia Ristau, a licensed psychologist. And we're going to talk a little bit today in an introductory way about the impact of depression on the lives of children. Just to give you a sense of what we'll cover, we'll first talk about the connection or the relationship between adverse childhood experiences and depression. We'll give you some idea about depression statistics and also how do children present with depressive symptoms? How does that look like? What does that look like across different ages? And then we'll talk briefly about mechanisms of depression, some new thinking on biological factors that might influence depressive symptoms, and then we'll finish up with a discussion of psychosocial factors that might tend to trigger depressive symptoms. And then finally we'll talk about resilient childhood experiences and different skills that we would suggest as a way to counteract the negative impact of depression in a child's life. So an antidote for ACEs, which we are calling resilient childhood experiences, but it's amazing that during the coronavirus pandemic, I found that this slide to be startling, really. We've seen an increase in the experience of anxiety or depressive symptoms in U.S. adults up by fourfold. So the incidence, if you will, of symptoms of anxiety and depressive disorders has quadrupled over the last 1 year period of time as compared to a baseline in U.S. adults. And I think even more concerning is that we know that children have experienced as well an increase in what are termed adverse childhood experiences. These traumatic events, if you will, that a person can experience in their life prior to 18 years of age that then have an impact on them as an adult. That list of adverse childhood experiences, or what we like to call ACEs for short, includes things like sexual, physical, and emotional abuse or neglect, household dysfunctions, things like having a parent, for example, with a mental health disorder or a substance abuse issue. And they've also added some new ACEs to the list, including things like bullying, having kids that have a physical or mental disability, things like discrimination or exposure to community violence. So there are a lot of reasons why children are struggling these days with ACEs. And the biggest concern is this, that when children do experience ACEs, they are then set up to be at risk later in life for both physical and mental health issues. On the physical health side is things like heart disease, obesity, diabetes, and cancer. On the mental health side, it's things like depression, which we're talking about today, but also things like ADHD, learning disabilities, and substance abuse problems later in life. And the big concern over the last 12 months has been that the coronavirus pandemic, according to recent studies, had literally been an ACE generator, so that kids across cultures all over the world are experiencing more and more ACEs in their lives day to day as a result of the difficulties brought on during the coronavirus pandemic. And as I mentioned, as these ACEs accumulate, we are going to see a group of adults later in life that have much more in the way of physical issues and mental health issues as well. So what we want to do is really begin to counteract that. You might guess that exposure to ACEs does lead to an increased risk, specifically of depression symptoms later in life. I thought this was an interesting statistic that preventing childhood ACEs could reduce the number of adults with depression by as much as 44%. So what we hope to do today is talk about those strategies. We call them resilient childhood experiences that counteract the negative impact of ACEs in a child's life.
All right, so as we dive into the different presentations today, one thing that it's worth pausing for just a moment to pay attention to and be aware of is that depression, just by nature of brain development, may look different in youth than it typically would for adults. So we're going to just dive into a little bit of a review here in terms of what the research tells us for prevalence of depression before 2020 and all of the things that 2020 brought us, and then what the indications are thus far as we can tell for what's been happening through the course of 2020 and into 21. And then we'll talk a little bit specifically about what depression looks like for children and teenagers. So prior to the different ACEs present during 2020, as Dr. Tim alluded to, we know from different research studies that around 20% of youth in the United States have been living with a mental health disorder. Around 11 to 12% of those youth meet criteria for a mood depression or a mood disorder such as depression. And prior to 2020, suicide was already the third leading cause of death for youth ages 10 to 24 years old. Next, we have to think about the limitations of online surveys, but this is the data that we have available to us so far. So if we look then what happened through the course of 2020 and probably as we've been moving our way through 2021, considering those limitations, what we know is that one particular study, for example, that looked at thousands of youth and adults across our country, the Mental Health in America survey, that showed us that the public use of one particular free online general screener for depression, in other words, people who were thinking, gosh, could I be depressed, looked for and found this free mental health screener, the use of that screener for depression increased in 2020 by 60% in comparison to just the year before. Those ages 11 to 17 used this online screener 9% more in 2020 than was the case in 2019. Throughout the COVID-19 pandemic thus far to date, youth ages 11 to 17 are more likely than any other age group to score in the moderate to severe range of symptoms for anxiety and depression, according to these free online public mental health surveys. That is astounding. By the end of 2020, according to a similar survey, the Mental Health in America survey, we were seeing that clinically significant symptoms of major depression for youth ages 12 to 17 was increased by about 4.4%. So according to this study, 13% of United States young people have experienced at least one major depressive episode during 2020. That's 2 million teenagers, just over 9% of the US population, who are living right now with severe symptoms of depression. The Child Mind Institute also did an online survey of parents. Now, these were parents who were already seeking out telehealth services, telehealth mental health services for their child or teenager. So the Child Mind Institute did a survey in 2020 looking at those folks, and what they found was that 2/3 of the parents seeking those services reported a perceived decline in their child's emotional well-being, in their mental or behavioral health, and in their physical health during 2020. 37% of those seeking telehealth mental health services were doing this specifically for a child or teenager who they felt was struggling with depression. So even though we know telehealth has really blown open the doors of access, allowing greater numbers of people to receive mental health, especially through this pandemic in 2020, we know that there's still about 70% of young people with major depression who are not getting the ongoing mental health care that they need. There's lots of reasons for this. For some, it may be insufficient insurance, which we know certainly is the case globally, as well as there's a number of insured youth who have private insurance that just doesn't adequately cover the degree of mental health services that they need. So out-of-pocket costs are soaring. One thing that we know even prior to the pandemic is that depression does tend to overlap with other areas. So we want to tune into these things with youth as well. I will say there is one positive side effect of this pandemic from what we can see so far. Often substance use and substance use disorders frequently correlate and overlap with depression. But what we're seeing actually with teenagers is a decrease in 2020 in the use of substances and substance use disorders. So it decreased from 7% to about 4%. Still, think about that 4% and the number of people that involves, and there's still a really good likelihood that there's the common overlap happening, but we're just not picking up on it as much as we might have before. There's also very much the risk that this could continue to grow as we move forward. The other thing to know is that unrecognized or untreated things, mental health challenges like anxiety, ADHD, or learning differences can also impact the development of depression and vice versa. According to the CDC, national surveys in 2018 tell us that a staggering 3 out of 4 children aged 3 to 17 years diagnosed with depression also live with significant symptoms of clinical anxiety. Additionally, 1 out of every 2 kids ages 3 to 17 who are diagnosed with depression also meet criteria for behavioral disorders like ADHD. A lot of signs and symptoms of depression, anxiety, trauma, and ADHD also tend to look the same on the surface. So this complicates things even further. Things like focus difficulties, hyperactivity, emotional reactivity, or even kind of a stunted or numbed emotional range can all represent 2 or 3 different things in the mental health realm. So we do want to tune in and really pay attention. It's also important then, if you're seeing some of these things, rather than jumping to your own conclusion in terms of what that might be, seek out that professional help. They can help you sift through and just make sure that you're approaching it in the way that makes the most sense. So when we're looking at depression, especially during a time like we're in right now with this pandemic and all of the other undertones present culturally and in the world around us, it's important that we're careful to not take what might be a normal reaction to loss and grief and mistake that for being clinical depression. So we want to be careful not to over-pathologize. It's a fancy word that we professionals will use when we take something that's a normal expectation and we view it as something that's really significant in a clinical way. Grief is a normal reaction to loss, and loss is rampant right now, especially for kids and teenagers. Think about their loss of routine and rituals, the loss of a sense of living in a safe world or having the same social opportunities or the organic ways to connect with other people that they had prior to this pandemic and prior to all of the violence and upheaval that's going on around us. There's a loss of physical affection and closeness, and then there's also this anticipatory grief about what they were expecting to happen. For example, their senior year of high school, and things are taken away that they might have been looking forward to. So there's a lot of different ways that we are in a state probably of natural ebb and flow of grief and loss that comes along with the territory that we're in. We want to recognize that this is a relative thing as well. What might feel like not a big deal to us with an adult brain, with a perspective that we've had in living the life that we've lived, might actually feel like a significant blow and grief and loss pain point for children and teenagers. So it's really important that we're not mocking this or belittling it or minimizing the impact that these things can have. The good news is grief and loss, if we couple it with healthy coping and build around it protective resiliency factors, this will help avoid the contribution that we might see otherwise leading towards a more clinical depression. So what is clinical depression in kids and teens? Well, how does it present is a typical word that professionals will use. Presentation essentially is just a clinical term for what does it look like? What are we seeing when we observe and report what is happening? Clinical depression in a true sense of the word means that symptoms have been present most of the time for that person, and this is true for kids and teens as well, for at least 2 weeks, are more intense than what might be expected for what's been going on in their life, and are interfering with their daily functioning. So their day-to-day activities with friends and family members are being impacted. Their school or work productivity is being impacted. Their ability to participate functionally in sports or even taking care of themselves is being impacted on a consistent and persistent basis. Some of the key pieces have to do with major mood swings, irritability, anger, and lower energy. Possible red flags, specifically with depression at a clinical level for youth. Again, the key is that consistency and persistence. In other words, are you seeing it on a regular basis? Not necessarily that it's constant, because with kids and teens it may come and go, but for most of the day, many days in a row. Possible red flags may indicate, again, hopelessness, irritability most of the time, and with teenagers this is tricky because they can be irritable just by nature. They may not necessarily look sad on the surface or act sad, but instead some kids and teens will engage in high-risk behaviors, destructive behaviors. They may feel detached from the people around them, or they're getting into trouble in a really unlike them way. There may be significant changes with eating, sleeping, energy levels, or interest in doing things. Sometimes I hear parents say they just seem lazy or unmotivated, or they're giving up. These are red flags to pay attention to. That signifies something fairly consistent and persistent has been going on that's alarming your parent signals. Significant changes, again, in terms of isolation, withdrawal, having difficulty paying attention and focusing, or even expressing a lot of sense of guilt, worthlessness, there it is, and shame, resentment, or even things like self-injurious behaviors, looking up and researching self-harm behaviors, self-destructive things, or thinking a lot about death or suicide. These are red flags to pay attention to. Now, when it comes to signs of normal kind of grief and loss, you're going to see a lot of overlap here. And again, the key is noticing if grief and loss seems to be continuing on a regular basis, and it's more days than not for more than 2 weeks at a time, then we want to think about, could this signal depression instead? In terms of different age groups, we do see different patterns that happen with grief and loss. So I just wanted to point out a few of those things, and then I'll get us moving on, I promise. All right, so at the elementary school age, so these are kids, usually I would say like 10, 11, and younger. Moods, just by nature, can be a little bit more variable, but when somebody is in the midst of grief and loss, we see with kiddos rapid changes, and they tend to be extremes. So it can be 1 minute completely devastated, and literally 10 seconds later, calm, happy, playing just fine, no big deal. So that vacillation is not unusual. Play tends to be more extreme, a little bit more rough. They may mimic what they're seeing around them through their play, so it's interesting to observe and pay attention to as the adults in the picture. Kids do tend to work through their grief through their play, and they may repeat things over and over in a cycle way in order to help their brains heal from the grief that they're experiencing. Sometimes we see regression as well with play, so they might start playing with toys that they haven't played with in a long time. And I was hearing this from parents as the pandemic was beginning. There were concerns like, oh my gosh, they're playing with things they haven't touched in years. That might have been a sign of grief and loss that the kiddos were working through. There's also likely regression with things like toileting, sleep. Kids who were sleeping really well all of a sudden aren't, or needing to sleep with a parent, clinginess, things like thumb sucking or baby talk, but also behavioral things like outbursts, meltdowns. We may see more of those, which is super great for parents who are also already maxed out themselves. It gets really tricky. And then underneath all of that, often we find kids who are really confused. They know they're feeling something, but they're not sure what they're feeling, and they're not sure why. So it's hard for them to put that into words. So when they're behaving in a way that an adult might think is naughty, and the adult is saying, "Why are you doing that? Why are you acting this way?" They're not necessarily going to have the answer for us. So we have to know that, and we have to be okay with that. we may have to be the one to give them the words for what their feelings are underneath that. Middle school ages, this is like tweens, 11, 12, 13. They, when they're in the midst of grief and loss, may be more confused, more tearful, more clingy. They may isolate a little bit more than usual. We do tend to see a little bit more of those extremes, but we would describe it almost as volatile, where it's really harsh and cutting sometimes, reactive, and very often towards the very ones that they feel the most secure and safe around. So loved ones in the home tend to be the greatest target for those who are in the midst of grief and loss with that volatility and the reactivity. They may need to talk about and re-talk about and re-talk about what their experiences were with a particular situation. And they tend to focus on things that they feel like they did or didn't do well. They have this heightened sense of like guilt or shame, like I should have done something different or I could have been better. But often that sense is very different from what others in the situation might have described. They may have moments of overwhelming sadness or fears. Sleep problems such as harder time falling asleep or even increased nightmares is more likely at this age. They may have a harder time getting their homework done or staying focused during the school day. And often at this age is when we tend to see kids in grief and loss having physical complaints that aren't super diagnosable or recognizable necessarily from a medical standpoint. So something like physical aches and pains, stomach aches and headaches, I would say are probably the most common that we see. Also sometimes like a harder time swallowing or breathing, things like that. Finally, with high school ages, this is already an age where teenagers are trying to figure out who am I, what's my purpose in life, what is this thing life all about. When they're in the midst of grief and loss, sometimes there's a sense of denial or disbelief. It's like, if I just don't admit it, then it's not really happening. So it might be hard for them to actually acknowledge that something hard is happening. The primary focus for them is blending in with others. So to look different is a major concern for teenagers. So when they're in the moment of grief and they're not sure how to express that, that can be a really vulnerable time for them. They don't want to look different or appear weird, so they kind of maybe bottle it up inside until they're in a safe place, which tends to be perhaps at their home. They're very self-conscious of their feelings and their own responses, and they're very prone to that same feeling of guilt and shame that we see with younger kids. But sometimes at this age, because of that, they become overly focused on revenge or getting even in some way. So we want to really tune into that and get underneath it in terms of the feelings of grief or loss that might be there. Teenagers do tend to isolate themselves to begin with, but what they don't do is isolate themselves from their peers. So if you're noticing that they're also now starting to isolate themselves from their peers and withdraw in that way, that might be a red flag, or even very much more so from those that they're typically comfortable being around with family members or whatnot. And there may be some aim to begin numbing or distracting themselves. So we see this sometimes even in waves of grief and loss with like an overconsumption of social media, video gaming, or YouTube, just getting really sucked in even more than usual, or obsessing over self-harm or different things that they feel like they have to do in order to feel better.
In this next section, we'll talk a little bit about things that perhaps cause depression from both a biological standpoint, but also a psychosocial standpoint. Conventionally, from a medical standpoint or a psychiatric standpoint, we commonly think about depression as being a deficiency, if you will, in a certain neurotransmitter. Most commonly, people think about, and I've heard about this brain chemical neurotransmitter called serotonin, and that mostly depression is caused by low levels of serotonin. And you know, for some people that may be true, but it's usually a lot more complicated than that. And the answer has commonly been then to start people on serotonin medications called serotonin reuptake inhibitors, things like Prozac, Paxil, Celexa that I'm sure you've heard about. From a psychological standpoint, we've also talked about a lot conventionally that depression can be caused by or triggered by negative thinking patterns, if you will, kind of getting stuck on negative emotional ideas or feelings and kind of ruminating on those over and over again. Also, medically speaking, we commonly Think about sleep disorders. You know, when people are sleep deprived, they are commonly depressed and irritable. But I just wanted to mention what I think is going to be the future of psychiatric approaches in terms of the assessment and treatment of depression, and that's involving two systems that are not directly connected to the brain in a sense, but treating depression by treating the immune system and treating the gastrointestinal tract. So in the case of the immune system, we're going to talk a little bit about immune system dysregulation and kind of this over revving up of the immune system that we call inflammation. From a gastrointestinal tract standpoint, we're going to talk a little bit about the balance of the good and bad bacteria that are in the GI tract. We're going to talk a little bit about the general overall health of the GI tract, and we'll even touch on things like food sensitivities and nutrient deficiencies. And the answer in these cases, again, you know, treating that system. So in the case of immune system issues, we're going to talk a little bit about anti-inflammatory therapies. In the case of the GI tract, we'll talk about healing the GI tract through a protocol called the 4 R's. So first, let's talk about this issue of immune system response and depression. I want to give you a definition of this term called inflammation first. Inflammation comes from the Latin word inflammo, meaning I set alight or I ignite. But most of us think about inflammation as a localized occurrence where we have symptoms when we have an injury. Let's say you strained or sprained your wrist or your ankle, or maybe you had a cut or a scrape on your finger or your hand. And what you commonly will see is a little bit of redness, swelling. It's oftentimes tender to touch and might feel hot. But think about that localized inflammation kind of getting out of control and becoming more systemic. And so many of us, because of the different lifestyle factors, will experience inflammation on a much more broad basis, if you will, across a variety of areas of our body and more systemically. And when that happens, when we have factors in our life that create systemic inflammation, what happens is our brain can also become inflamed. And when we have an inflamed brain, we can have a variety of mental health issues, including specifically depression. So about 1/3 of people that have depression, and research studies that have been done seem to have elevations in these markers for inflammatory proteins called cytokines in their bloodstream. But neuroinflammation can also lead to other mental health issues, things like anxiety and ADHD and dementia as examples. And the bottom line, and I'm not going to go into this in a lot of detail because you all have access to the slides, but I think we live in a world right now that is very pro-inflammatory. So various aspects of our lifestyles, stress, high carbohydrate diets, food allergies and sensitivities, lack of exercise, and also exposure to toxins can all kind of build on each other and result in our immune system getting revved up and our bodies and our brains experiencing too much inflammation. And so the bottom line, again, I don't have time to go into this in a lot of detail, but take a look at this on our website at naturalmentalhealth.com. We have some great blogs on this topic. I think the answer is in part adopting an anti-inflammatory lifestyle and really paying attention to the use of electronics, how much sleep we get, our physical activity level, and certainly the way that we're eating. Now, a second system that we can use to, I guess, identify and potentially treat depression symptoms is the gastrointestinal system. And I don't know how many people are aware of this, but your gut and your brain are intimately connected. And just for example, about 90% of the serotonin that's made in the body is actually made in the GI tract, not in the brain. And so we know that something is happening in the GI tract that's important to mental health. A variety of issues seem to impact mental health from a GI standpoint. We can have a breakdown of the lining of the GI tract called leaky gut syndrome. We can have the experience of depression actually from having a bad infection, even just having something like the flu. We also know that people that have food allergy and food sensitivities can rev up that inflammation system, as we talked about previously, and that can eventually inflame the brain and again contribute to depression. And then finally, nutrient deficiencies are really important, especially around the world in developing countries. We know that if you don't have the building blocks to, for example, produce adequate levels of neurotransmitters like serotonin, norepinephrine, and dopamine, just because your diet is deficient in those key nutrients, you may well then have a problem with your mental health. Just a couple of definitions. We all have billions of microorganisms, so that includes things like bacteria, viruses, and fungi that live in our GI tract, and that's normal. We're supposed to have that stuff there. And by and large, most of those microbes are actually helpful to us. But when those microbes or microorganisms get out of balance and we have too many unhelpful microbes and not enough helpful microorganisms, that situation can cause trouble for us, and that can also cause mental health difficulty. What the research is showing right now is that more and more is that people with autism spectrum disorder, ADHD, and depression as examples, as well as anxiety, might have a slightly suboptimal, if you will, and different pattern of these good bacteria and bad bacteria that live in their GI tract as compared to people that don't have mental health difficulties. And so the bottom line is, and again, I encourage you to take a look at our website, naturalmentalhealth.com, and read more about this, but they have developed a protocol called the 4 R's that allows us to heal the GI tract, put things back into balance, and in many kids that I've seen, this can really help with their depression symptoms fairly immediately. This protocol is called the 4 R's, and that stands for the letter R. So the first phase of this protocol is the remove phase, and what we do in this part of the protocol is put people on elimination diets. We eliminate things from their diet like toxins, refined carbohydrates, refined sugar, things like this, maybe food allergens for that person that maybe are causing a lot of reactivity in their GI tract. In the next phase, called the replace part of the protocol, we add things like digestive enzymes and stomach acid to help people to digest their food more completely and more effectively. In the third part of this protocol, re-inoculate, we add what are called probiotics or good bacteria supplements, and we also encourage people to eat more fermented foods that contain probiotics as a way of rebalancing that gut microbiome. And then finally, in the final part of this protocol, the repair section, we encourage people to ingest this amino acid glutamine as well as other herbs and supplements that can be soothing and healing to the GI tract, things like aloe, for example. And the bottom line is, even within 6 to 12 weeks, people can be feeling a lot better just by following through on such a protocol. And so I think the future of treatment for depression will include addressing issues for the immune system and the GI system in most people.
What you're saying is that we have decades of research and even more recent research that tells us depression is very complicated. It's a complex interaction of genetics, of biological factors. There's environmental factors, there's social factors, physical factors, and emotional influences as well. Some of the important factors that we know do impact depression from that psychosocial standpoint are important just to be aware of. We know that really anyone for whom their identifiers are different from that of the dominant culture are at much higher risk of developing clinical depression and developing really significant thoughts of harming themselves and such. So kids and teenagers from the LGBTQ plus population, kids who are Black, Indigenous, persons of color from within the BIPOC communities, Those who are experiencing bullying in any significant way, this can be in person, through social media, private or public. Any kind of sense of rejection from others, but especially peers, can be another significant psychosocial blow. I think about this particularly with all the use of social media, that kids really put themselves out there not realizing how vulnerable they're making themselves, because people who then come in and comment, who don't even know them, comment in a really rejecting, bullying way that can really feed that downfall in terms of their emotional health. Isolation and loneliness is important, but what's really interesting from the research, what tells us is it's not necessarily being isolated as much as it is how long have you been feeling isolated and feeling lonely. So the length of time is going to have much more of an impact, and we're going on a year here of a pandemic. So that's interesting to notice. We also have factors like big T trauma and little t trauma. This is sort of just a way of capturing really obviously traumatic events that happen versus additionally things that are experienced as traumatic for that person that perhaps another person might not have experienced as traumatic. Also noting that these things accumulate, they build, they're layered. So it's relative, it's collective, and it's layered. We also know that there's genetic and environmental influences. Studies do tell us that parents who have their own mental health challenges, including depression, even in utero, this can impact and increase the risk of their child or teenager developing depression as well. But there's other pieces of it far beyond just the genetic components there that are impacting families as well. So the thing to know, though, is that none of the contributing factors that we've talked about here today alone are sufficient to cause depression. So what does this mean? This means your child, your tween, your teenager, your young adult, they are not to blame for having depression. And guess what? Neither are you. Caregivers and parents, it's just not as simple as it being one specific thing.
So please stay tuned for the rest of the workshop experience throughout the day today. And what we'll talk about is all these options for counteracting any negative impact of traumatic experiences and depressive symptoms in a child's life. You will learn all sorts of great stuff about mind-body skills, nutrition, physical activity, exposure or time in nature, vitamin supplements for depression, and related topics that'll help you to really create I think a great toolbox or toolkit full of great tools and strategies to help to treat depression symptoms naturally, both for the child or the teen that is involved with the depression symptoms, but also to support the caregiver experience as well. And we'll have a variety of lectures across the day that'll cover that. Later this morning, we're going to talk about cultural perspectives, and Dr. Linda will talk about mind-body skills. Henry and I will talk about exposure to exercise in nature. And then later this afternoon, we'll talk about diet, herbs and supplements, and mindfulness meditation approaches as well to depression symptoms in kids. Thanks for listening.